So-Called is sponsored by loveboiseparks.org, which donates 50% of all profits to support, promote, and preserve open spaces in Boise, Idaho. Use promo code SOCALLED for 10% off all your purchases at loveboiseparks.org.
Don't be quick to say no. Always say yes or think about it, because I think the more experiences that you have, I think the better equipped you are to have a fulfilling life.
This is Mark Wojcik, and I'm wondering, how's your so-called career? Welcome to So-Called, the podcast that explores the why and how of work. On today's program, we meet Dr. Mary Barinaga, a family physician in Boise, Idaho, and assistant clinical dean at the University of Washington for Idaho WWAMI. Mary is devoted to helping train the next generation of Idaho physicians through WWAMI and RUOP, the Rural Underserved Opportunity Program.
So for my administrative job, I work for Idaho WWAMI, which is a 5-state regional medical school program that Idaho has been a member of almost 50 years. So WWAMI is a partnership between the University of Idaho, the state of Idaho, and the University of Washington School of Medicine that's been around since actually Governor Andrus and several other governors from states came together to create a public medical program for the states, for the citizens of those states. And I think I feel really lucky in that I not only do I have, with working with WWAMI, which is Idaho's medical school, I have this administrative role where I get to get out across the state. I get to work with doctors and hospitals and be get to see just the amazing people we have in our state, and but then I'm also teaching residents and medical students one-on-one, and so that's really a great variety, and so every day is a little bit different, which adds a lot of spice to it. I think it's just really wonderful that we live in a state where people are so open to having students and welcoming them into their practices, and also not just the preceptors, the patients. The patients of Idaho are so welcoming to students and so eager to be part of their educational process, and that's, I think, really cool.
Mary has a unique perspective on the WWAMI partnership as a product of the program, which allowed her to stay in Idaho for her training and medical practice.
I feel really fortunate with WWAMI. WWAMI, this partnership has produced such amazing, high-quality physicians throughout the state, and part of the reason is because we have such high-quality physicians in our state willing to open their doors to students coming in. Otherwise, our students would, be in Seattle getting all their training done there. So, Idaho students actually have the ability to do the majority of all 4 years within our state. All students do have to do 8 weeks at least of clinical in Seattle at one of the big quaternary care centers, but that's because there are things that we don't have in Idaho, like a burn center, or we don't have a level 1 trauma center in Idaho. So it's important to get exposure like that. So that's the best of both worlds too, having the opportunity to have a community-based education, which you get a lot more hands-on with. But you also can see kind of the ivory tower academic center sort of a thing. It is fun being a student in a community-based program where you might be the only medical student with your attending physician, so you're not having to fight with other, not really fight, but there's no competition between you to be able to go interview that patient or get to do that procedure or listen to that heart murmur or whatever with the person that you're working with, because a lot of times you're the only show in town. So yeah. Students love that, and that's a great way of learning. It was a big leap of faith that the governors of the states started, and originally it was WWAMI with one W, and then Wyoming joined in the 90s. So when I went through, WWAMI was WAMI instead of WWAMI. But yeah, that was a big leap of faith. No one had ever done anything like that. This is a really unique, this model of distributed medical education, really, there's no other nothing to this scale in the United States. And 3 time zones, because we have Alaska, we have 25% of the geography of the United States. So there's a lot of moving parts, a lot of details, which definitely sometimes can be very painful, but other times it's just this, but most of the time it's just this wonderful collaboration. Don't duplicate resources. Let's share resources. Let's And that's, you can really keep costs down that way. Well, and the other thing is I feel really lucky to have been a product of it, growing up on a sheep ranch. It was nice to have access to public medical education. If I wouldn't have gone through a WWAMI program, I would have had to go to a private school, ended up probably spending 2 or 3 times the amount of money, and having to leave the state to do my education. So this way I got to do a large part of it within Idaho. And to me, that was really important, to be able to stay close to my roots and my family, and be able to also explore Idaho by doing rotations and knowing where I might end up practicing. I mean, that's how I ended up in Plummer, Idaho for practicing for 12 years. It was a rotation I did up there, and loved it, and decided to come back and practice there.
So tell me what you like about the roles that you do.
So, I love being able to work with other physicians, with hospitals, with students, with residents throughout the state, with the ultimate goal of providing a physician workforce for our state. For my clinical job, I love working with patients. I really find a lot of fulfillment in both of those jobs.
Yeah, and I suspect there would be some crossover between those, or what you bring from one you take to the other, and vice versa.
Yeah, the thing about these two jobs, there is a lot of overlap. So not only am I involved with helping medical students in Idaho get their medical education and get their degree by setting up high quality sites for them to do their rotations at within Idaho, but I also get to teach one-on-one with students as well when I'm seeing patients. And so I get to kind of have the best of both worlds. I'm kind of a talent scout, so I try to stay as networked as I can across the state. So I work with all sorts of physicians, different specialties, different towns, etc., and look for those high quality physicians who enjoy teaching and want to make that part of their practice. So when our students do, for example, a pediatrics clerkship, they have a choice of several places throughout the state where they can go and get that high quality experience, and which I know will lead to a great final product, which is a practicing physician in Idaho.
So are there things that you enjoy less about your work, or that are harder to do, maybe is a better way to put it?
From the clinical standpoint, physicians have to deal a lot with administrative burden, which we feel pulls us away from being able to take care of our patients. And that ranges from things like the electronic health record, which, don't get me wrong, I would never go back to paper charts, but with the electronic health record, which was designed really for billing and scheduling and not really for doctors taking care of patients, there's a lot of added time, so that's a big factor. Then there are other things like what we call pre-authorizations to get a medication filled or to get an MRI ordered. There's just a lot of paperwork and administrative burden, and those are, I think, some of the issues that are burning doctors out.
Do you have any strategies or recommendations for how to deal with that or how to counter that?
Yeah, I think whatever job or field you go into, you're going to have things that you enjoy less and things that you recognize are inefficiencies, and sometimes you don't have a lot of control over the situation. But at least in my life, I have found trying to be part of the solution is fulfilling, trying to have my voice heard in a way that can help my patients and help my profession. And so, I think things that I do to avoid that burnout, I prior to what I'm doing right now, I was a full-time clinician practicing in a rural town. I made teaching medical students and residents part of my routine. So not only was I getting that face-to-face patient care, but I also felt like I was contributing to creating the next generation of physicians. And there was something called the RUOP program while I was practicing a rural family doc up in northern Idaho. I worked for the Coeur d'Alene tribe in Plummer, so I was the Rural Underserved Opportunity Program was a program where we would have medical students after their first year come and spend a month with us, and that was just a really joyous time to be the first one to teach someone how to do a pap smear, or the first one to show a medical student how to listen for a heart murmur. And those were things that really reminded me of the things that sparked my interest in medicine to begin with. And so I felt like that mentoring part was huge. And I think if you can find things like that in your career that kind of fill your cup up, that's and so being a RUOP preceptor, and it's really fun to see. RUOP is having its 30th anniversary this year, so it's really fun to see the past students that I had as RUOP students, and now many of them are out practicing physicians, and I see what a big impact they're having in their communities. So to me, that is really fulfilling. I think also trying to be involved with whether it's advocacy at the legislative level, advocating for patients, or for health policy issues. There's been lots of opportunities in Idaho for our students and residents and myself to get involved with things like Medicaid expansion and trying to make sure that some of the things that help increase and improve health outcomes can occur, and help educate our legislators about it. So there are so many things that we can do besides our day job that can help with, I think, burnout.
What is your background, or how did you come to be in the field that you're in?
There was no grand plan. I was not the person who always wanted to be a doctor from age 5 on. I grew up on a sheep ranch, so I had exposure to animal issues, working with large animal vets, and that was initially kind of interesting to me. I also had some mentors in middle school and junior high and high school that really nurtured my interest in science. I actually was pre-engineering to start with because I was always really good at math, and I thought, well, maybe this is the way I should go. But then once in college, had some other influences and experience that made me turn more towards medicine. So it was really not a planned situation. I think getting out and actually shadowing and seeing what some physicians do really sparked my interest. And I think that empathy and compassion and concern for people in general, I think, was nurtured more by medicine than some of the other professions I looked at.
Sometimes you have to go and try some things and see what fits. Or what is the best fit, right? Because you could probably have done any of them, any number of things.
Yeah, and I definitely did some shadowing where I realized, boy, this is not for me. I can think of a couple times where, I thought I was really going to like it, and then I thought, boy, I'm so glad I spent this time shadowing, because now I want to go a different direction. Especially when you're going to invest several years in something. After high school and college, you've got 4 years of medical school and then at least 3 years of residency, sometimes much longer than that, depending on if you do a fellowship or what specialty you go into. And so, it's important that you really have your eyes open before you head in there, because you want to make sure you're going into it for the right reasons.
Makes me think, what advice you might have for somebody who's looking or thinking about going into either becoming a doctor or somewhere in the medical field. Any advice?
I would say keep an open mind and really be curious and ask people what they like about their jobs, what don't they like about their jobs. Would you do this again? Where do you see your profession in 10 years? Those are folks who are boots on the ground, who are experiencing it. The other thing I would say is talk to students in those professions. So, if you're interested in medicine, talk to some medical students and residents who are in their training and ask them those questions. Talk to people who are later on in their career. Same thing with any other profession that you're exploring. But, spend some time exploring, read, ask questions, be curious, do due diligence before you make a big commitment like that. The other thing I would also say is don't let the length of training or the cost of training dissuade you from doing this. There are many ways to get student loans paid off, and I'm an example of that. I worked in a rural area and was able to get my loans paid off through a federal loan repayment program. Loved where I practiced and ended up staying for 9 more years. So there are lots of options, military, other sorts of loan forgiveness programs. And so don't let student debt be your guide as to how you spend the rest of your life, because you'll be able to pay those loans off. I'm a family physician that worked in rural Idaho, and I got mine paid off easily. And so I would say it's important to what I would tell students is find your people, which I know that sounds kind of strange, but I found myself going through medical school, I worked through a lot of specialties, and I worked with some fantastic people in all specialties, but I did find myself gravitating more to the folks who were primary care based, so the pediatricians, the family docs, the general internists, and I think that those are things you need to pick up on. Keep your antenna up. Who are the people you like to hang out with? Because guess what? Those are going to be the colleagues that you're with all the time. Some come into medical school with a very clear idea of what they want to do and stick with it, but most of the time, about 70% of the time, students change their mind at least once. If somebody comes in thinking, I'm going to be a neurosurgeon, but yet they've never seen a neurosurgery or really followed or shadowed a neurosurgeon, how do they even know what that would be like? And so I think as experiences inform their decisions, things can change. And so I really struggled with that because I'd never really had much exposure to medicine, and I found myself going through my years. When I was doing pediatrics, I loved pediatrics, and when I did surgery, I loved surgery, and that happened with every single clerkship. And so, I got to the end of my third year, and thankfully, family medicine was the last clerkship, which encapsulated most of the things that I loved, and so it was really nice to end with family medicine before I had to make that decision, because I just realized I can't give anything up. I couldn't give up seeing kids. I couldn't give up seeing men. I wanted to see people over time. The one thing that I probably would not have been great at is I don't think I would have been a great emergency medicine doc, because I like continuity with people. And in the emergency room, if you get continuity with people, it's not always a good thing.
Right. Yeah, sure.
So I found myself, when I was doing my emergency medicine rotation, always wondering what happened to the people that we had seen.
Looking back on your career and what you've learned, what advice would you give your younger self?
I would say this to myself, and I would say it to other people who are trying to figure out what to do with their lives. Keep an open mind and stay curious, because you just never know if an experience is really going to have a dramatic influence on your trajectory. I had no concept that I was going to go into medicine, when I was, in K through 12. I had interest in science, but, and then actually was interested in engineering, and then, had my mind changed later on. Same thing, if you would have asked me 10 years ago, when I was a full-time family doctor practicing in a rural area, would you be doing an administrative job? Would you be on faculty at a residency? And I would have said, no way. I'm a family doctor practicing in rural Idaho, And so you just never know what's going to come along. And so I would say always, don't be quick to say no. Always say yes or think about it, because I think the more experiences that you have, I think the better equipped you are to have a fulfilling life. I think the other thing I would, as far as just advice, I would say, try to, whatever you go into, and medicine is perfect for this, but try to be a teacher. No matter what specialty you go into, somebody taught you, and it's really important to be able to have an effect with the next generation. These are going to be the folks that are taking care of us someday, and so if you can, try to give some of your time and effort to teaching the next generation of whatever profession you're in.
So Called is sponsored by loveboiseparks.org, which donates 50% of all profits to support, promote, and preserve open spaces in Boise, Idaho. Use promo code SOCALLED for 10% off all your purchases at loveboiseparks.org. If you enjoyed today's episode, please let us know. Subscribe and leave us a review. So Called is available on Apple Podcasts, Google Play, and wherever you get your podcasts.